2 doses of vaccine are simply not enough. Get boosted now.
Booster jabs could provide much needed protection against the new COVID variant and prevent further restrictions as we head into the festive period.
If the government just sort of stuck its head in the sand and said, let's just wait and see what happens, let's wait for the deaths to happen, by then it would be too late.
We're opening up the booster to every adult over 18 who has had a second dose of the vaccine at least 3 months ago.
This accelerated booster campaign will come at a cost, with the NHS saying that some other health appointments may be delayed.
And in the winter months, when extra pressures are already putting strain on the NHS, is it even achievable? The data tells us we're more likely to get the new Omicron variant and more likely to pass it on to others, even if we've been double jabbed. But it also seems less likely to cause serious illness.
In a number of cases, these high numbers, we are not seeing deaths, so that's a big consolation.
Reasons to be cheerful, you might think, but as ever with this virus, there is a great deal we do not know.
None of the laboratory studies, although they're helpful, actually provide absolute proof, and for that we'll need to see what happens in the real world, and that'll be a few weeks away yet.
More than 50 million people in the UK have been double vaccinated, and 23 million had had a booster before the Prime Minister's call to accelerate the programme. Scientists advising the government say that over time the protection offered by 2 jabs wanes, hence the call for a top-up.
Boris Johnson says he's asking those on the front line for another extraordinary effort.
He plans to deploy 750 military personnel across every health region, additional vaccine sites and mobile units will be set up, and opening hours will be extended so clinics can run 7 days a week with more early morning, evening and weekend appointments.
That is a massive, massive target, and there needs to be a lot of planning and a lot of support on the ground for the people at the front line delivering those vaccines.
More than 23 million people have already received their booster jab, but this new target of booking an appointment for every eligible adult over 18 before the end of 2021 puts the pressure on an NHS already battling a backlog.
We want to do our very, very best to minimise any elective disruption. Can we say that we won't cancel anything? I don't think we can say and give that guarantee.
And despite being urged to do so by the government, those trying to book a booster jab online were greeted with a broken website. Long queues stretched outside walk-in clinics, and lateral flow testing kits were temporarily unavailable to order from the government's website.
The government is gambling on an approach that for now prioritises jabs in arms over restrictions on our personal freedom. But that is not a luxury that every nation around the world enjoys.
And that's a problem for the UK as well as other countries.
90% of people in Africa have no access to vaccines, when in the rich countries you are already going for your 3rd jab. That concerns us a lot.
Wealthy nations have administered more than 17 times the amount of vaccines as the poorest. The UK has secured early access to almost 340 million doses of the most promising vaccines. So this problem is only going to get worse. With only some of the world protected, the virus will still be out there mutating, perhaps pushing an end to the pandemic further out of reach.